Sorry for the delay. Do we have a quorum, Guillermo?
Let me check. I'll call roll real fast. Colleen is here. Brianna signs. Gerardo Montemayor is here. Dr. Silvia Dominguez.
Here.
Jose Gonzalez. Elizabeth Alonso.
Here.
Mara Mendez. Jesse Hernandez. Yes, sir. Nancy Cadena. Mariana Morales.
Here.
And Margarita Garza. I'm going to say yes, you have 6 out of 11. So yes, ma'am.
Alrighty, well, so without delay, it is 5:35 and I call this meeting to order. Thank you so much for joining us today. Guillermo, do you want to put up the agenda on the share screen? Or do you want me to pull it up? I don't.
Go ahead and get started and I'll drop it in the chat right now.
Okay, just to kind of go through with it. We probably don't have public comments, but just to confirm, do we have public comments, Guillermo?
I do not think so. Tiffany, do we?
No, we don't. Okay, thank you very much. Moving on to the approval of minutes of November 3rd. The minutes had been sent to you all before. I hope that you all were able to review it. If you have not, I will give you a few seconds to go into your emails and review the email that was sent to address the meeting today. The minutes are included. If nobody has any changes or any questions, I will take a motion to approve.
Motion to approve.
Okay, I have a first by Miss Elizabeth Alonso Villarreal. Do I have a second?
Yes, I second it.
Okay, I have a second by Gerardo, or was it?
Yes, Montemayor.
Okay, perfect. A second by Gerardo Montemayor. Thank you very much. All in favor to approve the minutes as presented, say aye.
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 Any opposed? Motion passes to approve the minutes. Our next item, which is the administrator's report. Just wanted to see if Guillermo, I know it's been a while before, it's been since November since we've actually met. Wanted to see if there was anything that has been updated or anything that's required for the Drug and Alcohol Commission. Is there anything to update us on?
As of right now, no. I do have a small piece to talk about for the detox facility update. But other than that, we are continuing as on schedule, I imagine, or as we can. We have had conversations via email about the vacant positions, but that is still very much a work in progress.
Okay, is that primarily because we have not been able to recommendation? Because some of them are actually vacant and they will be leaving pretty soon in the next couple of months. So it may or may not be a concern. I don't know, but we do have recommendations. I know that there's been people who have shown interest, and those have already been presented to council. So it's just waiting to see if they have their choice or if they will go with the choice that wants to get involved. So we'll follow up with that, and thank you so much for your due diligence, Guillermo and Tiffany.
Thank you.
For that.
Thank you.
Moving on to discussion and possible action on membership. One of the things that we just mentioned that we do have some vacancies already in place. And we do have a vacancy in District 1 with Rudy Gonzalez. We also have a vacancy with District 5 Council Member Ruben Gutierrez Jr. We do have those two vacancies, actually. I don't see anybody else. Raw vacancy. So if there is, again, the recommendation has been sent to the council members to recommend somebody from somebody who's been a stakeholder, somebody who's interested, invested in the Drug and Alcohol Commission. We have not gotten through. Guillermo, Tiffany, and Erica from the Health Department have already made so again, it's just a matter of pushing it. And if we get somebody, hopefully before the end of the year, that would be fantastic. If there are any recommendations, please let us know so that we can send those recommendations through and let them choose who is best for the position. With that said, we do appreciate everyone who is online right now. I don't know if the online meetings will be happening through and through, or if we're going to go back into meeting in person, but we do want you either way to be involved and participate and be active and share the knowledge that you have, and again, share the knowledge that you are learning through here, so because you all make the difference in our community. The next item to discuss and for possible action is to propose to recommend to the city and the county model of detox. I know, Jesse, at the last meeting, we had discussed a proposal to bring up to the city on behalf of the Drug and Alcohol Commission. Is that something that you want to have a committee, or is it part of the committee, a subcommittee that you already have that you propose this? How do you, or what is it that you want to be able to bring up to city council?
Okay, it's part of the subcommittee. Already we have a detox subcommittee. And I think, from my understanding, they're starting to work on it. So I think the next step is to give them an understanding. The protocol will be, as far right, how it's going to work and what our recommendations are. And so that's something that we just I think Marita and Mr. Manrique, we can sit down and decide, look at what are the best protocols, and we can present to city council. That's just a matter of sitting down again and reviewing what we want to do as far as the protocol. I mean, that's what you're talking about, right? What we're gonna, the staffing, the protocols. Is that what you're talking about?
Yes, so what I would like to see, Jesse, if you could also fill us in. If you think maybe perhaps for the next meeting that we have, would you like to present the proposed protocol members? That way we can set it up at next city council meeting so that you can represent us and propose that information. Is that
Sure.
how it would work, Guillermo?
Would that be okay?
I think that Jesse's on the right track. From what I remember, I thought Jesse wanted to write a position paper that would be the Drug and Alcohol Committee's position on what you all envision. But if you want to go to City Council and present, that would be fine too.
I think that there was a question of wanting to do something like what was being done in San Antonio, and we were talking about that we wanted to do a medical detox, and we want to set forth the protocols of medical detox. So we want to set up that position, and it's just a matter of Gerardo, Ana, Mr. Manrique, and Margarita and I are just getting together. We can do it on Zoom. Takes about an hour or so. We can write down everything, draft it out. Yeah. So we'll, I know the next week I'm really booked, but I'm probably pretty free on Monday. Week I've got tons of clients. I'm usually off on Mondays. This next week I'm not, but Monday 21st I'm pretty available, and I can make myself available. You know, I'll probably be about 3:30 because I pick up my granddaughter from school. So from, let's say 3:30 to 5 on Monday the 21st. Well,
That works for me. Yes, that works for me.
Yes, that's okay, Jesse. The 21st is
Okay,
fine.
so let me go ahead and write that down on the calendar and then we'll meet for about an hour and a half. I'll make sure I call Mr. Manrique and Margarita, and we'll get together and we'll get that ready for the next meeting. Okay?
Okay, thank
Yeah.
you very much. Our next meeting will be on April the 13th, and it is pending to see if we will be in person or online, but April 13th is our next set and scheduled date to meet. So if you all could present it to us, and then we can go ahead and either make plans to move forward with either presenting it to council or sending the proposal to council, either way, whatever works. That way we can get a full approval to see if that's something that can be done for the detox.
Colleen, this is Elizabeth. So when going to make a presentation to the city council, how long in advance do you need to be placed on the agenda?
My understanding, it should be between 2 weeks to a week.
Yeah.
So we wouldn't be able to do it for April 13th, that week. We would probably have to do it for either the end of the end of April or early May,
Okay.
if it all goes well with the proposal. But we do want to make sure that everybody's on the same page, and very well, if any who wants to chime in and give their expertise during this proposal, then you can very well get with Gerardo and Jesse, who are leading the group. Anna and everybody has done such a fantastic job, but it past through their experience and through the work that they're doing. So we definitely trust and confide that you'll propose what's best for our community, but we want to be able to know what's going on before it gets proposed and sent to council. But yes, we can.
No, and I was just saying that, so that when we do propose that, if as many of us could go and attend, that would be a good presentation.
Yeah.
Even if we're not gonna all talk, no, but at least to be there, for support.
No, I agree, Elizabeth. And if there's anyone that I missed, just email me, and you can join us. And we can either set up a Zoom, or we can use my doxing site, and we can have a discussion. So I already
No,
put
I
it
don't want to
in.
hold up anything, just, just when we go and present, I'm sure y'all are gonna present to the committee. So we'll take it from there. I know that y'all are doing a great job, and you'll present something very good.
Thank you very much, Miss Elizabeth. We will go ahead and keep that in mind, and we'll table the agenda item for proposing to recommend to the city county the model of detox for April 13th, and then we'll move forward with the plan of action afterwards. So we'll definitely keep that in mind to invite us all to the presentation if it's allowed, and to definitely show the support that we have for the work that's been done. Moving on to the detox facility update. I know Guillermo says that he had an update. So Guillermo, what are those updates?
Court meeting where the following item: discussion and possible action to enter into a construction contract with Quant Corp Construction in the amount of $1,773,682 for the Webb County Detox. Yesterday, my contacts at the county said that Quant Corp Construction is working with architects and Webb County to secure building permits to begin construction remodeling. So I imagine for the next meeting, building permits will be obtained and a construction timeline should be available. So we're finally off and running, guys.
that Jesse and the group needs to work a little bit harder before they start building something, and then it's like, hey, we needed it this and this way. So I think it's
I
very
think we're
pressing to make
okay.
sure.
Yeah, I think because isn't it true, Guillermo, that they contracted with someone to do the licensing of the facility, right?
Correct.
So we have that's a big piece. That's something that I've done before, but I, didn't want to do it. But so they contracted with somebody to do the licensing piece. So we just need to make our recommendations. The licensing piece will be done, the facility will be built, and they'll know that it's a medical detox, and then we're off and running, at that time.
So we're on the right track. So
We're on the right track, yeah, because I do remember they got somebody to do the licensing, and that's a good idea.
So
Okay.
keeping our fingers crossed, hopefully next meeting, I'll guarantee that timeline will be met because we all know about construction. But at least I'll present anything that the county and the construction company and the architects are willing to put on paper. But that's my report, ma'am.
thank you very much.
Thank you,
And
Guillermo.
and it's much appreciated. And I think the work that we've been doing for the life of we've been wanting to see this happen. So let's make it happen, and let's try to meet deadlines to make sure that we get the best outcome in the best time. So again, thank you so much for that update, and thank you all for doing what you've been doing. Moving on to the community presentation, we have the about some of the services that they are providing to the area. So I will go ahead and see.
I can go first. This is Sandra Guerra. I'm an intervention specialist with the Rural Border Intervention Program. I service Brooks County, Duval County, Jim Hogg, and Webb County. And I work with the youth and adults who have an issue with the substance use or mental health.
Good afternoon,
I also
everybody.
have, oh, go ahead, B. I'm sorry. I was just going to say I have B and Danny also in the meeting.
Yes, good afternoon, everyone. My name is Beatriz Sanchez, and I'm the program coordinator for the Padres program, which is the Parenting Awareness Drug Risk Education Services. And our program that actually we have service the whole region area of Region 11. But we do have virtual services that we provide all throughout the region. We do have intervention specialists and community health workers who provide case management services, parenting education for families, which are adults and youth. We do provide services for males and females. Our services are free. There's no charge for them. And we have staff who are stationed throughout the area of the region to be able to provide these services to these clients who are needing any type of education, but also the case management services. One of the things that we do right now is virtual in person, and we work with the clients to see where they are so we can be able to provide the services to them. But I wanted to share a little bit more information on some additional services that we also have that are serviced virtually right now. Some of the services are out there in the community, but we do have the recovery supportive services for those individuals who've gone through treatment and need additional support services. And I will be able to forward your information on that and as well as the attachment. But we also have a different program that we have, which is Empowering in Hope, which is treatment services that are also provided through the region, and they're also done through virtual services. And the Monarch is working more with youth. So we have a counselor who provides counseling and services for youth who have a substance use disorder. And right now the services are also done virtually. And then we also have Sandra with the RBI, and then the PPI program, which is a pregnant postpartum intervention that provides also virtual services. Some of our services are kind of scattered around, but that's the benefit of working virtually, that we can be able to do a lot of our services out there through our virtual platform right now. But if there's any additional information that y'all would need, please just do let me know. And I will be sharing what we call clinical services information. So if anybody needs to get in contact with that, with any of our staff, they can be able to contact me or any of this stuff that was listed in the form. Thank you.
Thank you very much.
Good afternoon. My name is Daniel Rodriguez. I'm the Prevention Resource Center Region 11 coordinator, or shortly PRC, covering the 19 counties. One of our biggest assets that we provide to all the counties in our region is the regional needs assessment, where we collect all data from substance abuse to mental health and provide protector factors and risk factors in that assessment, and it's free to the public. So every year we publish one, and by June or the latest August, and then we put it on our website. Or they want to show where the community stands or what are the gaps. So that's very important, showing gaps in our counties. And then we also do a small handbook, basically more for parents to understand. And that's when it's in English and Spanish, that small handbook. Then another part of our program is that we do compliance checks on tobacco stores, So I can say that in Laredo, when we went into Webb County last month and the month before, everybody was in compliance with their tobacco permit, and also the vaping. Also, if they're selling e-cigarettes, it's a new permit they have to have, and that one's a green one. The tobacco is beige color, and those stores that are selling any e-cigarettes or vaping products has to be green. So that means they're on good standing right now to sell that. And we provide resources like like when somebody asks about SCAN, they're in Laredo, we'll refer them when their meetings are at the first Tuesday of the month, or any other agencies in our counties that people need to be connected to. So that's part of our role with PRC here in our agency or our program, So, I mean, you have any questions? Hopefully I'll drop the RNA this past year that we did. I'm gonna drop it in the chat box. Hopefully you guys can see it. If not, I will put our website there too, so you can see it. That way you can go to our website for our program. See it there.
Okay, so you all, Beatriz, you all are located in Far, Texas. That's where you're from, is that?
Yes.
Sir. Okay, and I was noticing you do have both an adult and youth treatment program.
Yes, we do.
Okay, yes. So, one of the things, and I'm thinking, and Gerardo, you can correct me if I'm wrong, but the idea is we don't really have any detoxes in our detox facilities in our, not only in our community, but in even in a region, except really in our regions. And what I'm saying is where the linkage can be is that based on my experience, not only working with adolescents, I used to work with a lot of the adolescents in Health and Human Services Region 11, and we had a lot of adolescents that needed detox, and we will have an. And maybe, I mean, I remember when I actually ran the only adolescent detox in the state of Texas back in the day, and we would bus in people from the valley or bring them by minivan for detox here in Laredo. And so I imagine that that would be one of the ways to help your agency. And of course, you know, I believe, and correct me if I'm wrong, you know, Guillermo and Jerry, head of them, we want to open this up to not only our community, but whoever else. I mean, you know, I just was noticing those linkages that you also have the adult program. And thinking and to be realistic, knowing and just knowing what I see from a drug court, but I can actually see something with the adolescents that you may have, and obviously your adults. But that was just my comment. I was just reading the website. So thank you for your presentation.
Thank you.
Yes, thank you so much for your presentation. I appreciate you all making the time to visit with us and share about your programs. And I got connected with Ms. Sandra over an email that TAMIU was hosting a health fair, and that they were going to be present. And so I hadn't been familiar with their services, and so I thought it would be a good idea to share that with you all, because again, either you work with the future, where this information, this data, you know, it's very good resources that you already have done and that are regional needs assessment a little bit into detail, and see what actually our community has a greater need. So again, thank you so much. I don't know if Ms. Sandra wants to share anything else or anything further.
Thank you again, Ms. Rodriguez, for reaching out. I really appreciate